I'm a lot shorter than some of the speakers here. So I am a member of PNHP. I've been an advocate of single payer for a long time, ever since I was about as old as our next speaker. And I can do the whole slide thing with all the data about how we're 37th in the international scene with our health statistics and how we pay twice as much for care than the next per capita. But I decided not to do all of those slides for you tonight. And actually, what I'm going to do is just tell my story. I'm a family doctor. I've been in practice for 29 years. I worked the first 3 years of my career in a community health center up in New York taking care of the indigent. And I've been a self-employed, so I've been a small business owner, a self-employed private practitioner for 20 years in Midlothian, Virginia. And I've worked for the urgent care folks, if you guys have Patient First up here. And I've also worked in an emergency room when I first graduated. I'm currently a faculty member in the Department of Family Medicine at VCU. And I care for the indigent and for the employees of VCU Health System. So a lot of you who are healthcare people, I take care of those folks for our system. I also teach the foundations of clinical medicine to MCV students. So I have a great job. I have a great job and I have good health insurance. And I'm paid well and I'm unlikely to be unemployed because there's a real shortage of family doctors in the United States. I've never had to worry about my health care making me bankrupt. But I am a 30-year supporter of Medicare for All. So why is that? It's because I have a son who broke his back skiing up at Wintergreen, and he has a spinal cord injury, and he'll be uninsurable all of his life. Fortunately, he's in medical school, and he will be able to join a large medical group so that he can get insurance through them, but he's never going to be able to be in solo practice. I have a daughter who's a self-employed artist. She and her husband have to buy health insurance on the individual market, which those of you who are self-employed or artists, etc., know about that. And even though they're young and healthy, it costs $4,000 a year and they have a $1,000 deductible, which means most of their care they just pay for out of pocket. But fortunately, they started an internet business, and it's actually making them more than myself and their dad together, and so they can actually afford it. My third child is a freshman in college, and under our insurance until he's 23. Some of you may know about that time and think about, oh my goodness, get through college, get a job before it runs out. I worry about the affordability of insurance for him in his chosen career of high school history teacher. But hey, my family's doing okay. Why worry? I'm worried that there will be nobody to replace me when I retire. Fewer students are training in primary care each year, and more of those who are have gone to school outside of the United States. I see my colleagues in primary care who are taking early retirement or who are having to supplement their incomes with cosmetic surgery or selling supplements in the office. Many of the family doctors around this area sold their practices in the 90s to hospitals because the margin in primary care, believe it or not, because you all think doctors are pretty rich, the margin in primary care makes running a business really a constant struggle. In fact, I left private practice after 20 years because I couldn't see a way to earn enough money to move my practice into the 21st century. I needed to get an electronic record, but it was out of reach financially. During the 90s, my overhead was 65 to 70% due to the need to hire people to manage our referrals, which you guys probably all know about and hate. Well, we hate them too. Referrals, pre-authorizations, all the complexities of having 300 different kinds of insurance. And I saw that the insurance companies had raised my overhead, they'd increased the administrative complexity of my business, and they were crowding out the time that I had to take care of people. All at the time that they were telling me, hey, the community really needs more people like you, more primary care doctors. But the main reason that I'm for Medicare for All is because of what I've seen in my 29 years of providing a medical home for thousands of Virginians. Over the years, I saw that the people who were the happiest in my practice were my patients who had Medicare. Even though you hear about how bad the government is and how they can't do anything right, every time, the patients who are happiest in my practice were the patients who had Medicare. They had more choice, they could go wherever they want, they didn't need a pre-authorization, they didn't need to get a referral from me, and they had everything covered except their drugs. That was a big problem, obviously, and you know what we got for that. We got Part D, disaster, heart disaster. So I saw many of my patients who breathed a sigh of relief when they became 65 because they'd been scrimping on health care due to early retirement or due to a disability. I've also seen many, many people lose their health insurance. Some because an injury didn't heal fast enough for their employer, who let them go and then left them with no health insurance to continue healing. Most because they needed to change jobs. I've seen divorce result in kids whose parents struggled to keep them covered. I've seen people marry primarily to get health insurance. I've seen people stay in jobs they don't like because they had a chronic disease and they could not afford to be without insurance. And I see healthcare workers every day attracted to VCU specifically because they can get good health insurance there even though they're commuting an hour and a half to work. Over the years, I noticed that there were fewer and fewer of my patients who were getting approved for health insurance. Unfortunately, I keep really good records about my patients, and so the insurance companies would request records and they would always find something that was wrong with my patients. So I would have to be writing letters to explain that they had allergies or they had well-controlled high blood pressure or whatever, and they still got turned down. And I got repeated requests for records so that insurers could use the pre-existing clause against them. I've seen a couple devastated by leukemia in one and a year-long post-operative infection in the other that resulted in loss of job, then loss of insurance, then inability to qualify for Medicaid until they were literally reduced to poverty and inability to pay the mortgage. Is healthcare a commodity to be bought and sold only for those who can afford it? Are stockholders more important than the covered lives of the insurer? Why are we talking about health insurance when what we all want is health care for all? In 1965, Lyndon Johnson signed the Medicare bill to remove the threat of impoverishment from health expenses from the elderly, and it has done just that with a 3% overhead for 44 years. It's only a fluke of history that employers became responsible for health insurance decisions for their employees during World War II due to the freeze on wages, and so employers gave other benefits, and that benefit was health care. And that's how employers became responsible for health care in this country. It really was a fluke. The U.S., and this is probably the most important sentence you could hear, the U.S. already spends more public money per capita for health care than it costs per capita in Canada to cover everyone with no copays. This is both a moral and an economic issue. The economics of Medicare for All are straightforward. Do we prefer to maintain a for-profit insurance system that pays 20 to 30% of the healthcare dollar to dividends and to CEO salaries, or do we free our industries, our small businesses, to compete on the global playing field and ensure our citizens both guaranteed education and health care as a basis for a competitive society? HR 676, which I'm so pleased that so many of you have heard about, authored by John Conyers. It was just reintroduced. I used to say it had 92 sponsors, but now I have to say it has 50 because apparently they have to sign up again. And it covers all Americans at birth for all necessary medical care with no pre-existing conditions, no employer